Live. All right, so this is going up live, and then let's see here. Like I said, I have no idea how to work these things. I'm just like going around with it. But okay, perfect. Okay, so I think it's up now. So let's just start off. First question, you have to ask you obviously. So why don't you go ahead and introduce yourself? Tell us a little bit about what you do right now. And yeah, why don't you go ahead and do that real quick?
Okay, so I'm Christa Miliaresis. I'm a pediatric cardiologist in the greater New York, Connecticut area. My specialty is sports cardiology. I also see patients with hypertrophic cardiomyopathy, and I do a lot of preventative cardiology, but in general, I was trained for congenital heart disease. So I did my fellowship at Yale, and I'm at my dream job at the Maria Frere Children's Hospital and Boston Children's Health Physician. So yeah, I'm doing the lab, and I really, really love my job.
Awesome. That's right. I mean, it probably makes your day a lot easier when you actually like your job. So,
Yes.
So tell us a little bit. I mean, Evan kind of gave me the background a little bit about your story and stuff. But why don't you go ahead and describe, what gave you this passion? What made you really want to go into this and make this your career?
Yeah, that's a really great question, and got a lot of answers. Got some sort of practical answers that I just love the heart. I think the heart is fascinating. I have some just passionate interest in kids being able to do sports. I love sports. I've been doing sports my whole life, and it makes me so happy when I see kids do sports. And then on a personal level, I lost my mom to sudden cardiac death when I was a teenager. I was 14. And I think all of those factors kind of mixed together to make me feel really enthusiastic and driven to help kids with heart problems and to truly prevent sudden cardiac death.
Wow. So when that whole thing happened, I mean, and we don't have to get into the nitty-gritty of it, obviously, but when I'm just imagining just being at the young age when that all happened with your mom, I mean, that's still a pretty young age to even realize just how big of a problem, I guess, SCA is and these underlying heart conditions.
Yeah.
When was it that you really, I guess, realized how big of an issue it was? Was it when that happened, or did it take you a while?
It took me a really long time. I sort of fell in love with cardiology in medical school, and then I knew I want my patient population to be kids. And then during my fellowship, I realized that this very scary issue of kids who were seemingly in the prime of health, smack in the middle of maybe one of their seasons of whatever sport they loved, would suddenly die without warning. And that terrified me, but I could also relate to that sense of loss and the need to figure out how we can prevent that from happening. So I guess I was a fellow. So I was in my late 20s, early 30s.
Wow. So now, kind of taking all that and now doing what you do, I mean, do you have patients coming in who are in that kind of situation where they didn't realize they had this issue a lot? Is this happening?
Yeah.
Does it happen a lot?
It happens in real life. It happens not as often as I was scared it would happen. I mean, thankfully, as medicine progresses and people are becoming more aware, they'll come to me with knowing their family history already. So thank God, it seems like the incidence of sudden cardiac death in kids, it seems like it's not as high as I was afraid it was going to be when I first started becoming interested in this field. But yeah, it still happens. And it's really tough to have a conversation with the family and the child, especially if they're a big athlete, about how they're going to have to modify their lifestyle because they have a potentially deadly cardiac illness. So that kind of leads into another one of my passions, which is I want to be able to do some sort of research that demonstrates that exercise is not bad for a kid with HCM or long QT, that there's got to be some way for them to safely exercise, pursue their passion, but still, be mindful about the risk.
Absolutely. And that's actually really interesting because we had another doctor on last week, and she was she's actually in school to become a nurse practitioner and stuff. And she's on our medical board too, at who we play for. And, she was just kind of like, she has a lot of family members who have gone through this, and so far, because there's not a lot of research done on it, they're like, you can't play soccer anymore. or you can't do this.
Yeah.
And I just can only imagine how difficult that conversation is, especially again, with someone who is at such a young age.
Right.
Really probably can't even calculate how dangerous this really is. I mean, what do you even say to them?
I tell them the truth. I tell them that there's no good research that suggests or sort of dictates that you can't do sports. I tell them what the risk is. And then I say, if, you know, I have to document that you at least understand the risk, that if you engage in whatever sport it is that you're into, whether it's soccer or hockey or football, that you understand that there is an increased risk of sudden cardiac death when you have your sort of adrenaline going. And some families choose to say, well, we don't want to take that risk. We're just going to pull him out of sports. And some families say, you know what, this is a really huge part of his life. I don't want him to suddenly get depressed or have other kind of social, psychological issues about not being able to live his life or her life the way they want to. And so I just make sure that they understand that there are ways to mitigate that risk, such as having a defibrillator on site.
I just can't even imagine having to hear that conversation. And like,
It's tough.
It's tough. It's really tough. I can't imagine, you know, it's just one of those tough things I guess you have to go through as part of this. So when I guess are you doing this research currently then to kind of figure that out?
Yes, sort of. I'm at the infancy stages of it. So hypertrophic cardiomyopathy is one of the #1 reasons why athletes die suddenly in the field. So that's a big interest of mine. And so we're looking at cardiopulmonary exercise stress test data in pediatric patients. And by pediatric patients, I mean less than 21. I'm hoping that we're going to be able to individualize and tailor a risk assessment per child, per diagnosis, so that I'll be able to look at someone, let's say, who's 15 with HCM and say, I know you love soccer. Your septum measures a certain amount, your exercise stress test showed whatever, your Holter monitor, all these things. Given all of this data together, I think it is low risk for you to participate in sports.
Wow.
As opposed to maybe another kid that really, it would be super dangerous for them to participate, and then coming to figure out how to mitigate that risk, whether they need medication or surgery or whatever.
Absolutely. And sorry if you're hearing motorcycles behind me. I live downtown and it's like there's always craziness happening. But that is really cool. I think that's going to change a lot of lives if you can do that. I mean, that is really cool. I mean, because we do the heart screenings, you know, at all these orientations and sports events and stuff like that. And, you know, I can only imagine, because I don't personally see them when they get that call, like, hey, the doctor thinks you should probably be seeing and all this stuff. But it's just like, I can only imagine what hearing that is like, and having to change your entire life. I mean, not being able to play sports. I don't know, all that cooped up anger and, you know, like, what do you do?
I completely agree. I remember one kiddo when I was first starting out in my practice who had long QT, which predisposes you to very dangerous heart rhythm disorders. So this is going back almost, 15 years ago now. And, I told them sort of the party line that they're not supposed to be able to do sports. And this kid, he was like just a little jock. I mean, he loved baseball, football, and what am I forgetting? Basketball. loved. So I gave them the party line, you can't do sports. And I would see him every 6 months, check and see how he was doing with his medications. And he was a different kid when he didn't play sports. I mean, he literally was depressed.
Yeah.
Horrible to see. It was horrible to see. So that's kind of really where I was like, something's not right here. We have to figure out a way to get this kid to live life to the fullest, but still keep him safe. And that's when I realized that maybe there wasn't really enough evidence to say you can't do sports at all. There's got to be some middle ground.
Yeah. Especially because at that age, it's such an important thing for a lot of kids. You need an outlet. And if you aren't into music and, art and things like that, people need an outlet. I mean, that's really how kids learn how to, become who they're going to be, essentially. So I think that's really important. So let's kind of turn a little bit to, so how did you get introduced to like who we play for and stuff? Like through the heart.
Oh my goodness, how did that happen?
So I think Evan was telling me it was in New York at a heart screening.
Sorry, my daughter's behind me. Somebody introduced me to who we play for. Somebody sent me an email.
Yeah.
And I looked it up online and I was blown away. I was like, yes, This is it. This is normal people seeing a problem and trying to do something to make it better. I mean, this is America, right? Like, yes. So it was right when the whole COVID stuff hit.
Yeah.
So I didn't know if they were going to do the screening or not. But I showed up with the daughter that was just and I mean, I was so impressed with how smart everybody is and how dedicated everybody is and just how good, you know, and altruistic everyone is. And I'm like, yeah, I totally, this is it. This is a phenomenal volunteer organization.
No, thank you. But that's awesome. So with that kind of being said, you know, because not only are we doing the heart screenings, stuff like that, we're also pushing for counties in Florida right now to mandate heart screenings, things like that. I mean, from your perspective now, you know, being a cardiologist and stuff, what do you think has been the holdup? I mean, you know, why do you think it's just been so hard to get heart screenings mandated or just make it a normal thing?
That's a really big political discussion. I hate to sound cynical. I think it comes down to money. Yeah. I think that because the way our healthcare system in this country is created and sustained, that everything comes down to the bottom dollar. I hate even saying that out loud because that's not my philosophy. But yeah, I think because insurance companies are not going to want to pay for screening. And as painful as that is to think about, I mean, an EKG literally costs $10. Yeah. You know, that, or at least that's what insurance companies will reimburse. But I guess they look at the numbers and they think for all the kids playing sports, every kid that would need an EKG, maybe that adds up to some insane number that they're not willing to cover. I think that's the holdup.
Yeah. I mean, it kind of seems like that is when we go to the school districts, a lot of them just say, how are we supposed to financially afford this, you know, and stuff like that. So, I mean, it is probably one of the big reasons. I don't know. I mean, I'm a journalist. I'm not a doctor, but I mean, I do think that is probably one of the big reasons. You're probably really
right. I think it is. And thank God for, you know, organizations like who we play for. So, you know I'm not the only volunteer cardiologist, and as this grows, we're going to need more cardiologists to say, yeah, I'll read some EKGs for free, no problem. Yeah. So I guess that's how we're going to get around it for now.
Yeah, absolutely. Well, awesome. So let me go ahead and ask you, before I ask you our last question kind of thing, is there anything else that you think people would like to hear about, like your perspective from your profession or anything like that?
Oh, that's a really broad question.
I know, really broad. But
okay.
I mean, it's just like you guys, you get to see a totally different side of things than, you know, all of us. And we can talk until we're like blue in the face about how people need heart screenings and stuff. But if you could speak to the community right now, and especially parents of maybe people who are younger, what is the message that you would want to say to them?
Know your family history. That's critical. Don't be afraid to go to the cardiologist. I think people have this sense that, oh my gosh, if I go to the cardiologist, they're going to bench me and I'll never be able to play again. That's really not true anymore for the most part, especially when you start to see the younger cardiologists that are more hip to like the latest information. Yeah, it's just better safe than sorry.
Yeah, absolutely. Okay. And then our last question we ask everybody is, you know, obviously we say who we play for, and it's, you know, the reason that we do what we do. I mean, it's the reason we keep going, and so everybody has a why, a reason, and things like that. So we like to ask you, who do you play for?
My patients. I love them. I have the sweetest, most beautiful, adorable little kid patients, and I want them to live a long life and not, God forbid, have them lose a friend or a family member to a cardiac issue. And certainly I want them to not succumb to a cardiac issue.
Absolutely. Perfect. Well, that is it. That's all we had to do. Was that easy enough?
That was easy.
Okay, perfect. Awesome. Well, thank you so much for doing this today. Like I said, so we're live on Facebook right now. This will post to our Facebook page, Who We Play For, and then we spread it and, you know, post it on all of our content. And so if you want to share it and do whatever you want, here you go.
I will do that. Thank you. It's really nice talking to you.
Yeah, no, it is really nice meeting you. Hopefully next time, whenever the pandemic ends, we can all actually meet in person.
That'd be awesome. I'd love that.
Absolutely perfect. Well, thank you so much for doing this. Have a good evening, and for everybody watching, thank you.
Bye.
All right, perfect. Have a good night.